James Evans.
Presiding Officer, I'd like to thank the Cabinet Secretary for your statement today and also share with you thanking our NHS staff and our social care staff across Wales for the amazing job they do keeping us all safe during this winter period. Cabinet Secretary, as you alluded to, given the significant pressure on the NHS due to an early and intensive flu season, along with rising cases of respiratory infections like COVID-19 and RSV, this has put in huge pressure on our A&E departments. Given the decline in A&E performance against the 4-hour waiting target in September 2024, what specific goals has the Welsh Government put in place to reduce waiting times during the winter months, and what interventions are planned to tackle delayed discharges, staff shortages and inefficiency in triage systems, which often exacerbate the problems that we do see in our A&E departments? Also, Cabinet Secretary, the Welsh Ambulance Service, as you said, declared that critical incident on the 30th of December. It does highlight the severe challenges, including increased 999 calls and the prolonged handover delays at A&E departments. When I spent time with them out on the front line last Friday and also in the contact centre yesterday, it was actually quite telling that they said little things could make such a big difference. When I was there, they talked about having additional resources, more advanced medical practitioners, more GPs in that service, more mental health support. And they say if that could be put in there into that service, it would actually reduce the number of people who need ambulances, and more people could actually be kept at home with more higher clinical decisions being made about people's outcomes and where they're going. But one thing I do want to mention is about the steps that are being taken from government to support ambulance crews and call centre staff's crews well-being during this time, because I witnessed it firsthand, the pressure that they're under, and I'd be very interested to know what work you're doing, Cabinet Secretary, with the Welsh Ambulance Service to make sure staff are supported during this period. We all know that delayed discharges and bed availability are one of the big problems, and given the ongoing 50-day challenge that the Welsh Government have initiated, how are health boards adapting to this initiative to address the peak in hospital admissions that are caused by respiratory infections? And I'd like to know what measurable outcomes are being targeted in terms of bed availability as well, and the discharge efficiency, and how these are being monitored by government to make sure that that 50-day challenge is actually delivering as well. Because as we all know in this chamber, if you can sort out getting people out the back door and into social care or back into their homes, it does alleviate the whole pressure on the whole of the system across the NHS. It's not rocket science, as that's what everybody has told me, and I'm sure they're telling you the same. On the long-term NHS resilience, I think this is something we need to have a laser focus on as this Senedd, because I would like to know what the Welsh Government's long-term plan is to build a more resilient NHS, capable of maintaining our staff, maintaining standards and keeping people safe, because we do have these recurring winter challenges as well that seem to get worse year after year. So we do need to have that long-term plan. I know the First Minister said we don't need fancy strategies, but I think in the health service we really do. Because, Cabinet Secretary, I don't like saying this, our NHS is broken. Its staff are on their knees, and patients' expectations of the NHS are getting more and more, and demand is going through the roof as well. So I'd like to know what that long-term plan is, because we need to see one sooner rather than later from you. One issue I do want to raise, Cabinet Secretary, with you today as well is something that's broke in the news locally in my part of the world, which affects all constituencies on the border, is about Powys Teaching Health Board considering on Friday a number of actions to save money in the system that they've got there now because of their budget deficit, which also includes a recruitment freeze, a freeze on agency staff, and asking English health providers to keep Powys patients waiting for longer for treatment for elective surgery because they don't have enough money to pay the bills, as operations in England seem to be getting done quicker in Wales and they're more efficient than Welsh providers. Powys patients already feel like second-class citizens due to longer waiting times for treatment compared to other areas across the country, and proposals that deliberately extend waiting times will only deepen those problems. We've already been told that people need timely care, and the longer they wait, that means the more time they go into other services, back to GPs, back to physios, back to A&E departments, calling ambulances because they're in pain. So this proposal, if it does come forward, is actually going to create more problems for the health service, not make it worse. So, Cabinet Secretary, I'd like to ask you, what financial support can you provide to Powys County Council and what concrete actions can the Welsh Government bring forward sooner rather than later to make sure that we don't have a situation in Powys and other health boards, which could be set the trend across the country, that we can't send patients into England, or if they are in English providers, that they'll have to wait for longer because the system there is more efficient than what we have here in Wales. So I'd like to get your thoughts on that, Cabinet Secretary. And as I didn't open with this, it's an honour coming into this brief of health. It's a big challenge which I'm looking forward to, and I will work constructively with you to try and improve the health outcomes for the people of Wales. Thank you.
Thank you to James Evans, and welcome to the new portfolio. I agree with him. It absolutely is an honour to be in the health and social care portfolio, and I'm grateful to him for the measured way in which he put his questions at what is a very difficult time for the NHS and obviously for the public as well. He asked a series of important questions. I'll try to cover as many as I can. I think he was asking what steps had been taken recently, I guess, to prepare for the particular pressures which arise perhaps necessarily during the winter months, but have been particularly challenging this year. I mean, during 2024, a number of very significant steps have been taken. The NHS plans for winter constantly, obviously, but it seeks as well, obviously, to learn from previous years' experience. And it was clear from last year that the most common reason given then, as this year, for red calls to ambulances in particular was breathing difficulties. So a number of interventions reflected that. So he mentioned he'd been to see the Welsh Ambulance Service Trust and that they had talked to him, as they have to me, about the capacity for advanced practitioner paramedics to be able to do more, which is very, very encouraging, and the positive benefits that they see from more clinical capacity in triage and so on. And the reason they were able to tell him and me that is because they were using funding which we provided to employ more of those people. So we know that it works, and so I think it's probably fair to say that the resourcing which the Ambulance Trust had put aside for this year's winter period is probably more than the last 2 years. So the resourcing level going into the challenging period has been, I think, a good level of resourcing. On staffing in particular, the level of capacity was well provided for. So I think, the preparation work in terms of resourcing and staffing, I think, has been effective and robust, but the surge in demand has been, particularly challenging, even against that backdrop. In addition to that, he alluded to the 50-day challenge. That is a critical part of how we can put the service on a more stable footing generally. Obviously has a particular relevance at Christmas. So, that is a new initiative for health boards and local authorities working together. He asked me in relation to that how we could have confidence in the effectiveness or otherwise of the interventions which have been put in place. So there are two things in play there, and I do intend to make a further statement, as I committed to the Plaid Cymru spokesman a few weeks ago that I would do. Firstly, we have a weekly monitor from the regions looking at progress in implementing the various interventions. And separately, we have a monthly report of the numbers of people who are waiting for a discharge and are fit and ready to go home otherwise. So we know that we went into December this year. We haven't yet got December figures published. They'll be coming shortly. We went into December with a downward trend and figures for people waiting in hospital ready for discharge lower than they were in 2023. So a modest level of progress there, but progress nevertheless. What I will now want to see is the effect in December, and crucially, as we're now entering a period when discharge becomes particularly important, to make sure that system can work smoothly. I don't know, I haven't got the figures for that yet, but I am reasonably confident that the ways of working which have been developed during that 50-day period of intensity, putting new ways of working in place, will bear fruit in terms of the trend over time. So we'll obviously publish the monthly figures so that colleagues can see what they are. He asked me finally, finally before he mentioned the point about his local health board, but what the long-term plan was. And I think he makes a fair point. The challenge in the system this year is acute. We see winter pressures every year. The question then is why are they particularly acute? And I think the inescapable answer is when the system itself is operating at a level of pressure, there isn't, as it were, any slack in the system to be able to deal with this surge in demand. So the solution to that, the long-term solution to that, is to enable emergency departments to function more smoothly. And we have established programmes in order to do that, backed up with significant levels of funding. Swansea Bay Health Board, for example, has had a challenging few weeks, is still having a challenging few weeks in terms of admissions. They've been talking to the Get It Right First Time team, the GIRF team, who look at how systems work in all parts of the health service, actually, but in this context, in the ED department, and can advise on how to improve practice to ensure smoother delivery. So those sorts of initiatives are underway, but also he'll know that we are reviewing the approach which we set to red call targets for ambulances to make sure that ambulances are available for those who need them most. So there are a range of interventions in the system already in place with funding, and when they bear fruit, we will be able to see a reduction in that pressure, and that will ultimately put the service on a more resilient footing. His final question, I know there'll be others in the chamber with an interest in this as well, I spoke to the chair of Powys Health Teaching Health Board before Christmas. We had made available significant additional funding in the weeks before Christmas. I don't have the figures in front of me, but I'll happily write to the member with those figures. I saw as well what the Health Board have published. Clearly, all health boards need to be able to balance their budget. This isn't a negotiable element. And so what I hope to see is that the board is able to make decisions which enable the budget to be balanced and also to make sure that people get the care in the timely way that they need and deserve.